My name is Dr. Wagaki Gicheru. I am an anesthesiologist based at Kenya Medical Training College, or KMTC, here in Nairobi, Kenya. KMTC is an old institution. It was founded in 1927, and its mandate is to train middle-level healthcare providers. So we train nurses, clinical officers, and other allied health workers here at Kenya Medical Training College. We are conducting this interview at KMTC Simulation Lab, and the lab was opened about a year ago in 2021. We have been using this space to provide simulation-based training for our students. This facility has two parts to it. We have one that is for didactics, and we have a second room that we do the simulations in, which is divided into two. We have one side that is the operating theater, which is behind me, and there is also another space that we use like a critical care, but we can also use it for other spaces like an ER, or we can use it for maternity. We just modify the space depending on what we want to use it for. This simulation was funded by a partner, and the idea was to enhance training around anesthesia and critical care. But we have also, because we train other disciplines, we also would like to use this space also to have more of interprofessional training. So not just have the nurses or the clinical officers who are training in critical care or in anesthesia using this facility by themselves, but training together so they can be able to understand how they can work together as a team. We found that in MTC, or actually most health training institutions, we tend to train our trainees in silos. So we have a program that has just one group of students within it, and they only interact with one another when they are in their workspaces or in the clinical area. But we want to see whether we can have a model where in KMTC, using simulation, they can interact with one another as trainees, as they see how each person contributes to care. So you would have then a clinical officer with a nurse who are training in critical care, but they come together in the simulation lab and be able to practice their roles and their skills together in a scenario that is provided by the faculty. So that is the intention. That was the intention of having the simulation lab, and that is what we would like to see happening a lot more. In this sim lab, we have been using the space mostly for anesthesia and critical care, and so our equipment is based on that. One of the things that we would like to expand is also be able to have more, not just anesthesia and critical care, rope in maybe our peri-op nurses, so have a lot more surgical skills that we can be able to have and partner together with in terms of the scenarios that we provide. It has been a lovely space. We've been able to utilize it for our students. The students that we have targeted in this space are the ones who are coming for specialty training. And that is a population of about 200 to 300 what we call post-basic or higher diploma students who are either doing, as I've said before, critical care, anesthesia, peri-op, oncology, emergency medicine, and so this space is available for them to use. We want to, going forward, we envision a situation where we can have similar labs in other campuses, because KMTC is not just located in Nairobi. We have over 70 campuses, and many of them do offer that specialty training. So we would like to see where we can have a sim lab available for them, so that they can also have the privilege of training at the same level that the students in Nairobi are also training at. So that it presents our first challenge, that we have one lab that is situated in only one campus. The other challenge that we have is that because we are doing a lot more specialty simulation training, that sometimes we don't have the appropriate tools and equipment to have the scenarios run effectively, what we call fidelity. So creating the realism becomes a challenge, because then you're adapting too many parts. and so it's maybe sometimes hard for the students to suspend disbelief. But we are still using whatever we have available, so sometimes we have a mix of technology as well as mannequins that are low fidelity to try and bring the realism in, and so that becomes the second challenge. I think also sourcing some of the mannequins has been a challenge, but we're trying to grow our mannequin and the ones that we have slowly by slowly. So every year we try and maybe increase by one or the mannequins that we have available. So apart from resources for the technology and the mannequins for simulation, the second challenge that we have is faculty. As we all know that simulation, though it is being used a lot in developed countries, in developing countries we are just moving into that space. We have been comfortable in doing task training, so we have skills labs and people know how to use skills labs and are able to train healthcare workers on skills. But the using simulation and even incorporating simulation in education is a new field. And even for us at KMTC, we're just moving into it. So we are now beginning to have that conversation around what is simulation-based education. How can we change what we've been doing to incorporate simulation? And then on top of that, how can we upskill our faculty so that they can then understand the role of simulation and be able to see how they can incorporate it and utilize it so that their trainees get the full benefit. Of course, just like everybody else, we were thrown into the simulation space because of COVID. But we're saying that we have seen the advantages and want to grow it. So we are very much interested in developing capacity, partnering with other people who have gone before us in terms of done simulation for longer, have a better understanding of how to use it in our kind of setup, as well as for the level of trainings that we have. So that would be a nutshell of simulation at KMTC and simulation here in this particular space.